Hi, I'm Jeffrey.
And I'm Ashish.
During UC Berkeley's Summer Biodesign Immersion Experience, or BIE, the cohort traveled around the Bay Area to various clinics and medical centers including UCSF, San Francisco General Hospital, and the Iron Overload and Bone Density Clinic at the Children's Hospital Oakland Research Institute. Our purpose is to learn about and identify the unmet needs associated with each site and medical specialty. Let's now focus on these 3 visits.
The Toxicology and Poison Centers at San Francisco General Hospital have a vital role in emergency medicine. They analyze human lab specimens such as blood and urine to identify the toxins present in patients, whether they come from food, biological compounds, prescription, or illicit drugs. The information that the toxicology group discovers is used to diagnose and manage the conditions in a timely and effective manner. Dr. Wu and his lab specializes in mass spectrometry and actively uses it to identify the compounds in each person's blood and urine samples. He and Ms. Kastner, a supervisor in the clinical lab, introduced us to the various kinds of mass spectrometry techniques, including the laboratory's high-resolution liquid chromatography mass spectrometry. The cohort recognized several needs, including the difficulty in identifying the original compounds from metabolites and the trade-off between speed and sensitivity in diagnostic tests.
The UCSF Gastrointestinal Surgery Department works on conditions of organs of the digestive system, including the esophagus, stomach, liver, and intestines. Dr. Jonathan Carter, a gastrointestinal surgeon, specializes in minimally invasive laparoscopic surgery procedures. The BIE cohort witnessed multiple surgeries including hernia repairs, gastric bypass, and an esophagogastrectomy. We observe the importance of user and mechanical design in medical devices and equipment, as they can either enhance or limit a surgeon's ability to effectively perform a surgery while minimizing the risk of complications and injury. For example, a laparoscopic camera avoided the need for an open surgery, but the field of view was also reduced, resulting in a greater amount of time dedicated to positioning the camera. The joints of the surgical instruments of the robotic system that was utilized in this hernia repair procedure enabled Dr. Carter to operate with greater precision and ease than would a conventional laparoscopic instrument. However, the complexity of the joints also limited its strength, especially in suturing through thick tissue, and required more time to set up. Observing the necessary modifications, improvisation, and manually intensive processes that Dr. Carter and his surgical team performed to complete the successful surgeries we observed underscored various opportunities for design improvement that bioengineers can serve.
In the Children's Hospital Oakland Research Institute, scientists and physicians work to treat and research about various blood and bone diseases that affect individuals from childhood into now adulthood. In our visit, Dr. Marcella Waymiller and Dr. Ellen Fung presented about thalassemia and bone density health respectively. We then toured the facility, witnessing dual energy X-ray absorptiometry and procedures on 2 students of the BIE program. Otherwise known as the DEXA, the scanner images and assesses bone density and reflect overall bone health. We were informed that patients with thalassemia require blood transfusions every 2 to 4 weeks, resulting in very high iron content which needs to be chelated out through medication. The very sensitive ferritometer machine, the only one in the United States, uses magnetism to detect iron concentration in the liver to see the efficacy of these medications. In our visit, we noted a lack of accessibility in the ferritometer. We also realized that iron overload in thalassemia patients results from the blood transfusions. If there is a way to process the blood before transfusion, the patient would have reduced risk of iron overload and less treatment would be needed.